Hello, I'm Mel Ferguson. I work at Curtin University in Perth in Australia. And I just want to start off by saying what an absolute pleasure it is to be giving this presentation at the Future of Hearing Healthcare conference. And I'm absolutely delighted to be talking about a project that's very close to my heart, the HearChoice project. And this is a project which has developed a digital decision aid to educate, engage, and empower adults with hearing loss. I work with a number of really excellent researchers in Australia, and these are the organisations that they work for. This research is funded by the Australian National Health and Medical Research Council. So good hearing does not last forever. As many of you in the audience will know, that people start to notice hearing difficulties and have in challenging situations, such as shown on the left, at family parties or in restaurants where it's noisy and people just can't hear what is said. And hearing loss affects 1 in 6 of the population, and so that is 4 million Australians. And what we're asking with this particular project is, can HearChoice help with some of the challenges that we see with the current hearing healthcare system? And these are shown here. So, for example, it takes 9 years from when people first notice that they have hearing difficulties to doing something about it. On average, about 2 out of 3 people who have hearing loss don't do anything about it. And even those who go and see a hearing care professional at an audiology centre are often only offered a limited range of hearing options. So that's usually simply hearing aids or do nothing. And in fact, in Australia, about 40% of people who do go to see a hearing care professional leave the clinics empty-handed. And there's a number of reasons for this. One is that there's generally poor knowledge and misinformation about hearing loss, hearing healthcare and hearing aids. And in particular, people have unrealistic expectations around what hearing aids can and cannot do. Now, this research was informed by research priorities, and this isn't just an idea that I thought was good to do. This was taken from, the idea was taken from research priorities that had been identified by key stakeholders, including adults with hearing loss. So this was the roadmap for hearing health from Australia, and the report of the independent review of the hearing services programme. So this is the subsidised hearing care program that's offered by the Australian government. And then finally, research priorities were identified in the UK's National Institute for Health and Care Excellence guidelines on hearing loss that were published in 2018. And all 3 of these guidelines recommended that there be development and evaluation of the clinical effectiveness of decision aids. And the reason being is that adults with hearing loss are to feel empowered to make safe and informed choices on their hearing healthcare options. So the aims of HearChoice is shown on this slide here. So they are to develop and evaluate an online decision aid support tool to increase informed decision making and to increase earlier access and uptake of hearing healthcare. Now, importantly, when we do research projects, it's important, I think, to try and get our research findings into clinical practice. So we also have an aim, which is to establish how to scale up HearChoice and make it sustainable, if indeed it was shown to be useful. So on the bottom, we've got the schematic, and we can see that people seek help, they make a informed choice about hearing care, and finally make a decision. And all of these can be helped with the HearChoice app. Now, ultimately, as I said, the aim is to see an increase in uptake of hearing healthcare. But at the end of the day, we've got to realise that HearChoice is simply an app. And so what we're really wanting to see is that people who use HearChoice take some kind of action for their hearing difficulties. It might be to go and see a healthcare professional, which would be the ideal option, but it may be that they go and get a TV streamer from their local store. So HearChoice has been co-designed. I'll say a bit more about that later. We've identified it being unbiased and trusted because we don't mention at any point in HearChoice any manufacturers or any brands, so it's brand agnostic. And what we do is we bring all the information that people need to make a decision about their hearing healthcare and have it in one place. It's evidence-based, based on research from our research, but also from research from others. And we follow all the guidelines or all the requirements of the international standards, the IPDAS guidelines. So it's the International Personal Decision Aid Standard Guidelines. So in HearChoice, we talk about some of the impacts of hearing loss, what it is, what all the available hearing healthcare options are, with the aim being to give people better hearing health. So we're looking to educate, engage, and empower adults with hearing loss. The study design is shown here. We have 4 work packages. The first is a needs analysis, followed by the co-development of HearChoice. The third package is the evaluation with a randomized control trial. And again, as I've mentioned before, the fourth, we're very interested in implementation, and this is our 4th work package. Importantly, stakeholders' voice is embedded all across the study in every single work package. Where we're at the moment is we're just about to start the randomized control trial next week, in fact. And we've already started work on some of the implementation aspects that I'll talk a bit about. So the first work package was to understand the early hearing journey, because we really don't know an awful lot about that. And we wanted to find out and identify what the barriers enablers to help seeking and informed decision making are, and to identify features that are important to include in HearChoice. And we did this with semi-structured interviews with 16 adults with hearing loss, 9 who had sought help and 7 who had not. We then held 2 focus groups with a total of 9 hearing care professionals. And then we carried out some online surveys with adults with hearing loss and HCPs. And what we saw from the structured interviews, and to really sort of show what the issue is something that this lady said here. She was a lady in her early 60s, and she'd been having difficulties with her hearing for some time. And she said, I feel a little bit clueless about going forward. And I think that's a barrier that a lot of people feel in my position, because you don't have that information. You just feel a bit defeated. And then she went on to say, I just want basic information about what it might cost me, what I might be able to get from the government, what I might be able to do, those types of things. So this is our sort of typical target audience for HearChoice, and these are the issues we want to address. So we did the interviews and the survey. We planned it based on the COM-B model, which is a health behaviour change model. And this has 3 separate parts: capability, motivation, and opportunity. And all 3 impact on the target behaviour, which in our study was help seeking and informed decision making. So I'm going to talk about the results from the interviews. We identified 28 barriers and enablers to help seeking, and 14 barriers and enablers to decision making. And on the left-hand side, you can see the kind of factors that influence these. And on the right-hand side, the features of HearChoice, which will address these issues. So for knowledge, what came out as being important was to include signs and symptoms of hearing loss, to ensure people had realistic expectations, and to talk about the benefits of hearing healthcare. Importantly, and this was number 1 in both the interviews and the surveys, people wanted to know about the costs of hearing healthcare and how it was funded. And the features of HearChoice that were built in included being a trusted go-to for clear and accessible information and advice. In terms of motivation, the the factors that were most important here were factors to do with the hearing practitioner. So those are factors that we can't directly influence, but we can indirectly help the client. So people said they wanted their HCP to offer clear explanations and to address their individual needs. So what we aim to do with HearChoice is to empower users to self-advocate for themselves, either to do something with or without an HCP. And then finally, in terms of opportunity, the big factor was feelings of trust in hearing care. So what people were saying to us was that they didn't want to feel like they were being flogged hearing aids. So what we do with HearChoice is provide unbiased information about hearing care. And people have said the fact that we're not trying to flog hearing aids, or we're not trying to push particular manufacturers or brands, and make them feel as though that HearChoice is trustworthy. So moving on to the survey, we asked our adults with hearing loss what options they had been offered if they'd gone to see a hearing care professional. And as you can see here along the top, we've got the percentage of participants who were offered an intervention, and the interventions down on the left-hand side here. So hearing aids were the most sort of prevalent information. Around about 60% of people were offered hearing aids, and this fits with what I was talking about in the introduction. But of all these other options, less than or around 10% or less than 10% of people were offered these options. Now, what happens in this slide really addresses this and shows that there are missed opportunities, because this slide shows the percentage of participants who were interested in intervention but weren't offered it. So if we look at these interventions here, we can see between 60 and 90, just over 90% of people were interested in options but weren't offered them. So there are missed opportunities that we aim to address in HearChoice. We asked about HearChoice and what people thought about it, and support for HearChoice was high. So we gave a brief explanation of HearChoice to both our adults with hearing loss and the HCPs. So 3/4 of the adults with hearing loss said they were interested in using a tool like HearChoice. And of our HCPs, 85% said they thought HearChoice would be useful. 75% said they would be glad if a client had used HearChoice, and 68% said they would recommend HearChoice to their clients. Now, since then, we have developed HearChoice and shown it to quite a few HCPs, and I would guess that if we did, or I would anticipate that if we did this survey again in people who knew what HearChoice was, these figures would be much higher, and same for the adults with hearing loss. And in fact, I want to share with you an email that I received spontaneously unsolicited from one of our CCI people, one of our consumers who was helping us develop HearChoice. And she, at the middle of last year, she emailed me and she said, gosh, HearChoice progress looks really, really good. As a consumer needing to make assistance choices, the tool felt like I had a personal coach assisting me to navigate the website. Moreover, it breathed non-judgmental, no hard sell, no pontificating, no bias, with simple, empathic language. And the reason I'm sharing this with you is that this email really encapsulates the ethos of what HearChoice is. Now, for work package 2, when we developed HearChoice, we took an iterative consumer participatory co-design approach. So we spent all of last year developing HearChoice. We had multiple workshops with our CCI, our consumer and community involvement panel, who were involved every step of the way. We also had a community advisory group. And towards the end of the year, we tested HearChoice on a group of naive people with hearing loss. So we got their views, and we had the input from someone who many of you will know, Andy Balavia, who was really instrumental in helping us address some of the UX issues. What we have done with this approach, we've been able to embed the perspective and views on our adults with hearing loss in terms of the specification and the minimal viable products we produced. And these included things like helping us make decisions about the decision-making flow, how we present the options, what the wording should be. The readability is that of around a 12-year-old, and for them to talk about their own experiences. And I'm a big believer in the saying down at the bottom, no research about us without us, because I think we get much better products. So we're just going to say a little bit about the HearChoice app. So there are a number of different tabs along the top that you can see here in the laptop version. And I've got here the first tab here, which is called Learn. So this is where we just get people to think about their hearing loss. We provide information around various aspects of hearing loss. So, for example, with signs of hearing loss, they just click on this button and a box will appear and they can say what their own personal experience of hearing loss are, so they can tick those. And throughout HearChoice, we have videos you can see on the top right of adults with hearing loss talking about their own experiences. We talk about the impacts and benefits of getting help, and we have a section on Mythbusters. We then move on to services, so people can check to see if they're eligible over here with a quiz to see if they're eligible for Australian government support. We provide information on different types of hearing care professionals, the pathways, what the hearing tests are, and people can test their own hearing with a triplet test that's available on an Australian government website, and they can assess their own social and emotional impact of their own hearing loss with the social isolation measure. And then we get to the choose section. So really, this is the meat of what HearChoice is. And here we provide all the options that are available, including non-device and technology options, including do nothing. So for each of these sort of umbrella options, we provide a little brief summary. And then if people are interested, they can click on the button here and they can find out more about what's available. So for learning to listen better, we provide information around communication skills and auditory training. For well-being and connection, we provide information around hearing support and wellbeing support. So we've got an app that's been developed in Australia that people can go to. For technology to support hearing, we provide information around TV streamers and remote mics. For sound enhancing devices, we talk about PSAPs and amplification apps. And of course, we talk about hearing aids. So what we do at this stage, if people click on any of these options, we provide a little bit more about what each of these options is, and we say where they can get it from, for example, online or an HCP, and how much it will cost them. We then move on to, people can say what they're interested in, and then we move on to my plans. So whatever they're interested in goes into this sort of little basket at the top here, and people can view more information. And here, this is where we talk about the pros and cons of each of the interventions, which is essential to meet the IPDAS guidelines. Interestingly, in terms of hearing aids, we had a few people when we were trialing the MVP and the paper copies, they were saying that for hearing aids, they really liked the pros that were offered. You know, they really felt as though this explained what hearing aids could do. But what was really interesting was that although they liked the pros, they liked the cons more. And they felt as though because we were saying what was some of the limitations of hearing aids, it made them feel as though we provided unbiased, balanced, and information that they can trust. At this stage, people can then go on to say whether they want to take action or not. And if they want to take action, we provide some options and we ask them to do it within a particular timeline. And then they end up with this PDF that they can save to look at later, or they can print it off and take it along to their to have a shared decision-making conversation with their HCP. So what do adults with hearing loss say about HearChoice? So these were people who'd not used, been involved in the HearChoice project. They were completely naive participants. And they said the purpose of HearChoice was clear and unbiased, and people said that it was easy to navigate. They also said it was well structured with great explanations. And one lady said the language was sympathetic, simpatico, and inviting. People said it was easy to understand, and one chap said, "I'm impressed. Everything you need is here." Now, what was interesting with the user testing was that we were just looking to see whether people could use HearChoice or not, but we found it actually prompted behaviour change. So this lady, this 67-year-old lady, she'd already seen an audiologist, and she said, "I wish I'd known this before I saw the audiologist." She said she's now going to see about getting a hearing aid now, where she had been planning to wait another 6 months after she had gone on holiday. And in fact, she went and got hearing aids, and she's on holiday right now. This chap said that he wasn't aware that there were so many other options. And he said, "I'm going to get a TV streamer later today." And indeed he did, because he sent me the information a couple of days later. And then this lady, she'd already got hearing aids, and she said what she really liked about HearChoice was that it normalized hearing loss and reduced the stigma, so you don't feel like you're alone. And she said, "I'm going to start wearing my hearing aids again because of this." And in fact, she is doing that. So our UX testers indicated with some questionnaires that HearChoice was highly usable, useful, and impactful. So the mobile app rating scale gave very high scores, where 5 was the highest in terms of information, aesthetics, and functionality. You can see the mean scores there. Engagement was a little bit lower because people weren't able to customize HearChoice, certainly not in version 1. They all said they would highly recommend HearChoice to others, and the average star rating out of 5 was 4.5. In terms of the perceived impact, with some questions that we asked, people said that they felt as though much more aware of hearing loss, how to seek help. They had better knowledge, and this HearChoice increased their intention to take up hearing care. We used a generic system usability scale, and this gave a score of 93.4%, and anything above 80% is considered excellent. So I'm now going to show you a video about one of our testers after he'd used HearChoice, and he kindly agreed to be videoed.
I've been reading HearChoice and all the different technologies that are now available, which I didn't know anything about. There's some very, very useful information included in HearChoice. There's a lot to take in, but you take out what is applicable to yourself. It's just helped me maybe make better decisions on where to go and what to do. So quietly confident, really, that there will be something out there that will suit my needs. Start my journey on making a big difference.
So that was Glenn, and he went on to get hearing aids, and he's really happy with the outcome, and I'm really delighted to have been able to show you that video. So moving on to the evaluation, the RCT, Work Package 3. We're starting an RCT next week, where people will either get HearChoice or an active control, which is an option grid that's been developed in the UK, but we've Australianised it. And we'll measure outcomes before 7 days after they've used HearChoice, and at 3 months. And I just want to go and say a little bit about what I think is going to be really, really useful information from the RCT. We were able to go and measure all the clicks, so we can see how people navigate through HearChoice, and we'll be able to sort of get a better understanding of how people make decisions, because right now we really don't have much idea. We'll also be able to identify client profiles, and on the right hand side here, you can see this is sort of a summary of what we think we'll be able to get from the work looking at this, and by using machine learning, get a better understanding by looking to see where people go, what the pathways, where they'll go from one page to the next, which we see by the different lines. So I think this is going to be a really important output from the RCT. Now, moving on to the implementation work package, the aim is to scale up HearChoice across Australia and make it sustainable. So we're going to do this with some market research. We want to trial HearChoice in clinics and get clients to compare HearChoice, people who've got HearChoice with those who don't, and look at clinic outcomes. Because at the end of the day, we think if we really want HearChoice to be taken up, it's got to also be of value to audiology clinics. Now, our value proposition is shown here. So what we're looking at with HearChoice is that it will improve the businesses of audiology clinics. HearChoice is more likely to direct people to their HCP. People who use HearChoice will be better informed. As a result of shared decision making with the HCP, this will lead to better quality of care. We anticipate this will lead to higher take-up of hearing healthcare. Because people have a better experience, this is more likely to lead to high retention of clients. And that is really important because it costs an average in Australia $1,500 to get somebody into a clinic and to get them to take up hearing healthcare. We're going to be taking a commercialization approach to make HearChoice sustainable, and we've been talking to lots of people in professional and business bodies, HCPs and hearing aid manufacturers, and we've had a very positive feedback about taking this approach. So where does HearChoice fit in the workflow? It could fit in before the initial assessment, so when the client books an appointment with the HCP, HearChoice can be sent out. So they've already got that knowledge and feel empowered when they come in. Or else HearChoice can be offered after people have already had their initial assessment, so are more empowered when they come in at the follow-up. And we're currently looking at this with a number of clinics, and we're asking questions. Do we see higher uptake of hearing care? Does the client feel better connected and have more of a trusting relationship with the HCP? Is workplace morale improved? I.e., people or HCPs have a better experience also, and to look at other takeaways from these appointments. To summarise the work that we've done so far with some early conclusions, there are many barriers to help seeking and decision making in hearing healthcare, leading to a huge unmet need, and we're looking to address these with HearChoice. There are many missed opportunities in hearing health, and we provide a whole range of different hearing health options. And I think it's important to say here that we see these non-hearing aid options as likely being gateway products to eventually hearing aids, which at the end of the day is probably the better option for many people. And it could also warm people up to thinking about what they need for their hearing health. And we saw this with some of our MVP testing. HearChoice has been co-developed with users' voice at its core, and we think because of this, we've got very high support for HearChoice. HearChoice is rated as highly usable, useful, and impactful. And as I've explained earlier, we've seen it prompt behaviour change. We're in the process of evaluating HearChoice with an RCT and market research. And we just started in the process of commercialising HearChoice to implement into clinical practice, to assist with a scale-up across Australia, making it sustainable. And of course, we're looking at taking HearChoice to the UK, Europe and the USA. So if anybody wants to find more about HearChoice, please do feel free to email me. I'd be delighted to show you the HearChoice product and talk it through with you. So finally, I'd like to thank everybody who's been involved in the project. There's been a large number of people, some names that you'll almost certainly recognise. In particular, Ellen Both, I'd like to thank, and Kat Penno, who's been working with me on the commercialisation. So if you've got any questions, please do email me, and thank you for listening.